You know, if you thought the fight over what so many now refer to as Obamacare was over, it is not. It has simply moved to state capitals.
While the Supreme Court upheld most of the Affordable Care Act, it left up to states whether to expand Medicaid. Medicaid expansion is going to be one of the most contentious issues lawmakers wrestle with in Topeka and Jefferson City as they prepare to start new legislative sessions in both states.
It is one of those issues that gets complicated fast. In this report from Sam Zeff, we try to make sense of it all by picking apart what's at stake so we can better understand the arguments on both sides.
Healthcare in America is as much about numbers and acronyms as it is about doctors and nurses. So in the next few minutes, you're going to hear a lot of numbers. 138% will be an important one. So will 15,400, so look out for those. You'll also hear a couple of bureaucratic phrases that simply can't be avoided when talking about Medicaid. The most important of those, federal poverty level, and something called DISH in the hospital world. But if you don't remember anything else about Medicaid expansion from this story, we want you to remember this.
For me, it will mean that, my life expectancy will go up.
That's Jennifer Wishar from Lawrence, who is one of about 500,000 people in Kansas and Missouri pulling for expanded Medicaid. Like almost everything with the Affordable Care Act, her predicament is complicated. We'll tell you more about that a little later. While you can debate whether expanding Medicaid is good public policy, what's tough to argue with is that health care keeps people healthier.
We know from long years of research on uninsured people what that means. That means they will be healthier, they will be more able to hold jobs, they will earn more money, their mortality rates will be lower. So we're actually talking about fewer people dying as a result of this.
Before we dig into the politics and policy of Medicaid expansion, it's important for you to know some of the mechanics. So here's some of what we talked about at the beginning of the story. Medicaid expansion is based on something called the federal poverty level. This is simply the income at which the federal government says you're poor. To be covered under Medicaid expansion, the income of a single person can't exceed 138% of the poverty level. That's about $15,400 a year. In Missouri, it's estimated that 300,000 people would qualify. In Kansas, about 240,000. And contrary to what many think, most of those people have jobs.
These are folks that work hard every day. They pour the coffee at the coffee shop for you in the morning. When you go to the convenience store and buy your gas and your lottery ticket, you see the same individual there. And it's very likely that he or she has that job and another job, and neither of those jobs provide them access to any kind of health coverage they can afford.
But expanding Medicaid is going to be expensive. Very, very expensive. An estimated $1 trillion over the next decade. Here's the deal. Washington will pay for it all for the first 3 years, and the state's portion of the bill, as the law stands now, will never go above 10%. Still, 10% of a lot is still a lot. Hundreds of millions of dollars more a year in both states. Neither Topeka nor Jefferson City are swimming in money, so how do advocates for expansion make their case? Well, they change the argument. The Missouri Hospital Association joined with the University of Missouri to produce this study that focused not on the delivery of health care, but rather the delivery of dollars and cents. The study says expanding Medicaid in Missouri will create 24,000 jobs, adding at least $9 billion to the state's economy.
What's been interesting of late is the business community has really come behind this very strongly.
Herb Kuhn is president and CEO of the Missouri Hospital Association, who's leading the charge to expand Medicaid. We expand Medicaid somewhere down the road, even at 90%, that's hundreds of millions of dollars extra a year, correct?
Correct.
But what I'm hearing you say is that with efficiencies, with increased employment opportunities, doctors, nurses, technicians, and other efficiencies, this is going to pay for itself?
All the numbers point in that direction, whether it's new opportunities for new employment with new taxes coming into the state, whether it's relieving the state in terms of some state-only funds that they do pay right now to provide health care services for individuals, and through other efficiencies. All the projections look like right now, at least through the balance of this decade, that this could ultimately pay for itself. It's a no net cost to the state of Missouri.
I would argue that we can reduce over time these other parts of the budget that is going into direct services if we expand Medicaid.
Sheldon Wisegrow runs the Health Reform Research Project in Topeka, and he says providing regular health care to tens of thousands of more people in Kansas will produce savings in places you haven't thought of. One of those places is in our jails and prisons. This is the Johnson County Jail in Olathe, which spends about $450,000 a year treating inmates with mental illness.
Jails the size of the Johnson County Jail, we're actually the largest mental hospital in the state of Kansas.
Johnson County Sheriff Frank Denning says 17% of his inmates are being treated for some kind of mental illness.
We can only deal with one part of it here, and that's simply incarceration and prepare them and treat them so they're able to go to court. But you're exactly right. Some of the intervention needs to be done before they come into the system, and that's going to be a big question that's going to be posed not only to the criminal justice system, but it'll be something that's posing itself right now to the mental health providers, to the legislatures that have to design funding for these types of programs that you and I are talking about.
Okay, it's time to talk about one of those bureaucratic terms we mentioned at the beginning of the piece. It's called DSH and stands for Disproportionate Share Hospital. And that refers to all of the money the federal government reimburses hospitals for their uncompensated care. One of the biggest providers of uncompensated care in the Kansas City area is St. Luke's. Officials there say they provide $45 million a year in care to people who have no insurance or no money. That figure would be much higher without DSH. And here's the catch almost all hospitals fear. Because the Affordable Care Act anticipated so many more people covered by Medicaid, in 2014 the federal government is drastically cutting back on DSH.
It is clear, and we've been able to do some projections looking forward, that hospitals and medical providers will have to make some tough decisions about what services they can continue to sustain without any means to offset the cost.
So without Medicaid expansion, you have to stop providing some services?
We haven't specifically looked at what those would be.
But there are some services that would have to go away. I'm not, regardless of what they are, but there were some services that would have to go away.
Yes, absolutely.
Layoffs?
And not only service cuts, but Seelan says the possibility of layoffs. So she says with Medicaid expansion, St. Luke's will likely add jobs. Without it, service cuts almost for sure and a chance for job losses. So now we have to deal with the politics. And in Missouri, that's very complicated because it's not just up to the governor about whether to expand. The General Assembly has got to get involved. So we're driving to Carthage, Missouri, which is right next to Joplin, where we're going to interview Representative Tom Flanagan. Flanagan is a Republican, vice chair of the Budget Committee, and has been on the board of McCune Brooks Hospital in Jasper County. So he knows health care and health care funding.
Obama won the election, and that's a fact. We have Obamacare, and that's a fact. So going forward in the General Assembly, that issue of Obamacare is something that we're going to have to face, and that is a fact.
But it's also a fact that the Missouri General Assembly is dominated by conservative Republicans. Indeed, new House Speaker Tim Jones has called Medicaid expansion reckless. The state estimates expanding Medicaid will cost Missouri taxpayers $400 million through 2020. But during that same time, the state will get $8.3 billion from Washington. And while Flanagan's door is open to Medicaid expansion, it's open just a crack. He's unimpressed with newspaper editorials in Kansas City, St. Louis, and Springfield backing expansion, or even a recent poll by the Missouri Foundation for Health that showed 52% of Missourians favor expansion.
In November of 2012, people turned down what arguably would be the easiest tax to raise. They said no to cigarettes. If they're going to say no to cigarettes, they're not going to turn around and say, oh yeah, oh, Obamacare, yeah, sure, we'll vote for that.
A lot of people lining up behind this.
Mm-hmm.
Missouri hospitals are for it.
Right.
Primary care physicians are for it. State Chamber of Commerce is for it. Kansas City Chamber of Commerce is for it. I mean, these are formidable people who don't necessarily fall on the warm and fuzzy side of healthcare. I mean, these are some cold, steely-eyed folks who are looking at the business side.
When I don't see it going forward. I don't see how you can look at what the Hospital Association put out, and I've seen their study. And it's a nice study. It was put together at the University of Missouri. It's a great study. But you're looking at something, you're going to try to go forward 8 years and project something 8 years down the road. I just got out of a meeting about 2 weeks ago trying to predict the consensus revenue figure for the state of Missouri going forward 18 months. And we had a lot of discussion and a lot of discussion on what that's going to be. And that's an 18-month figure. Now we're talking, the Hospital Association is talking going out 8 years.
Hard to believe?
I think so.
And there's even less believing in Kansas.
If you had to make the decision, you would say no to Medicaid expansion.
Yes, I would. I would say no to Medicaid expansion, but we wouldn't stop there. It's no, we're not going to do this, but we are going to find ways that we're going to make health care more affordable and more accessible.
Dave Taubert is president of the Kansas Policy Institute, a conservative think tank. They did a study that says expanding Medicaid will cost Kansas $4.7 billion over the next 10 years. To be fair, the Kansas Health Institute has a study showing the cost to be 10 times less than that, but that just shows how complicated this whole thing is. And unlike Missouri, the decision to expand or not rests solely with Governor Brownback. The governor's office wouldn't go on camera and in a statement simply told us, Governor Brownback continues to discuss options and alternatives with like-minded states and with our legislative partners in Kansas. Taubert says he's worried the federal government is so far in debt that it will eventually stop paying the 90% match and stick states with the bill.
The more that we start giving anything away free, in this case health care, the money that's going to cost is going to come out of school funding. It's going to come out of other social service programs, or it's going to come out in the form of much higher taxes, which is going to have an economic impact of reducing jobs.
In the end, all the studies, all the politics, and all the debate boils down to this. What does it mean for people like 35-year-old Jennifer Wishar? She was laid off a year ago from her job at a nonprofit in Wichita. She's one of 5 million Americans who are considered long-term unemployed. For now, she's covered under a provision of the Affordable Care Act for people with pre-existing conditions. But just like DISH payments to hospitals, the Affordable Care Act gives and it takes away. The program ends in 2014 when Medicaid expansion takes effect.
But, I mean, people who have Medicaid know that if they go to the emergency room, you know, that's something that's going to be covered and they're not going to go into bankruptcy because of that. What do I want to tell them? That we matter. I mean, simply because people are low income does not mean that they are in any way less human or less deserving.
That report by Sam Zeff. KCPT's reporting on healthcare issues is funded in part by a grant from the Healthcare Foundation of Greater Kansas City.